Good morning. A very important session conducted in memory of Wing Commander Surendra Kumar Jain. It is a memorial oration. It is instituted in the fond memory of Dr. Jain's husband, Wing Commander, by generous donation to Geriatric Society of India. The order is elected by the Geriatric Society of India for his work contribution to the field of geriatric medicine. The oration will be awarded every year during the annual conference of the Geriatric Society of India. And this time, the oration goes to Dr. Sharma, who doesn't need any introduction. We know that he is the pillar behind the Geriatric Society of India, and he is everything. Geriatric Society is synonymous with Dr. Sharma, who is a professor of geriatrics, Dr. Sharma. He is a secretary of geriatrics, Dr. Sharma. Who introduced geriatrics, Dr. Sharma. So he is everything, and actually we are dedicated to him for focusing on this subject, and now geriatrics has been accepted as one of the super specialties of clinical medicine. And also we know that the population, elderly population is increasing, and I can only about Kerala. Kerala geriatric population above 60 is 16.5%, while the national is only 10%. And we predict that this will increase to 25% in the year 2040. And in the year 2040, it is also believed that the population, the proportion of people below the age of 15 will be less than the proportion of geriatric people in Kerala. So that is the situation. And definitely the whole credit goes to Sharma ji for this propagating geriatrics as a specialty. And as mentioned here, he is going to talk about optimizing geriatric care, navigating challenges, and leveraging strengths, because there are so many problems in geriatrics, starting from depression, ability, incontinence, impotence, so many things. And
Thank you, chairpersons, respected chairpersons. I remember way back 1980 when API was organized in Trivandrum. API was organized in Trivandrum. I met three senior physicians from Kerala, Dr. K.B. Krishnadas, Dr. K.P. Paulos, and Dr. N.N. Ashokan. And all three played a very important role in my life. I remember when, as founder of IMA South Delhi branch, when I met this young member, Dr. I.S. Jain, I found her very enthusiastic. And I met her husband also, Wing Commander Surendra Jain. A couple of years later, when we lost Dr. Jain, ever since that, Dr. I.S. Jain had been wanting to do something in his fond memory. And by her generous contribution, she started this Wing Commander Surendra Kumar Jain Memorial Geriatric Oration. Both of them were from Air Force. I won't mention here that it was a love marriage. I am going to talk today about a subject over which I have been going to Government of India, discussing with them, getting a cup of tea, and then being shown the door. Get lost. The same thing happened with me. I remember in 2008 also, when I made the first guidelines for vaccination, I went to the Director General Health Services, a friend of mine. He offered me a cup of tea, listened everything and said, not enough money, you can go. This time, I remember I met an important doctor who played a big role during the COVID, and that is none other than Dr. Vinod K. Paul, a member of Niti Aayog. And I discussed with him about this issue. He said, Dr. Sharma, I'll give you an opportunity. Call a bigger group, which will include NMC, the ministry, etc. And then there you can give your views. Same views, friends, I'm presenting here today. Optimizing geriatric care. It's actually, you read any newspaper, they sensationalize, they create sensations. I mean, they don't talk of small remedies or good things. I remember one of the chairpersons of a public sector, I, this gentleman in the PSU meeting said, he said, if there is something bad that I do, press will blow me out on the floor of the house. The member parliaments will make hallagula about it. But if I do something good, I have to crease the palms of the press to get the news published. Same thing occurs. People talk geriatrics, and they blow it out of proportion. I don't think it is that difficult a job which I am going to talk today. There are challenges, yes, there are challenges and challenges everywhere, but then there are strengths that we have got and we can manage it. Yes, it's a natural phenomena. The world over, the population of elderly is going up, and so it is in India. Different figures are there, but they are all projections based upon the population survey done earlier. How relevant they are, God only knows. Well, we are loudmouth people and we make a lot of commitments. We have made commitments at the national level. Where we have made commitment in Vienna, the International Convention on Aging, way back in 1982. We again made the commitment and repeated our same thing in Madrid during the National Convention. And in 1998, when Dr. Kofi Annan was the Secretary General of United Nations, he declared that 99 will be the International Year of Older Persons. And from that time onwards, everybody opened up the eyes. Well, everybody knows it was way back in 1999 that in USA, one Austria-born physician, Ignat Nasher, he coined the term also, geriatrics, and the great lady Marjorie Warren in UK led the biggest ward of 900 patients. But question was, who will do the same thing? Who will bell the cat? Should it be Government of India or should it be Geriatric Society of India? Geriatric Society of India, formed in 1982, whose I am General Secretary from 1988 onwards, took up the lead. They said, okay, let the government take its own time. We'll do something for them. And we remembered these two stalwarts, the one who started in USA and the one who started in UK, and we thought we'll do something. Well, the population is increasing because of aging. And aging, a simple definition, is a progressive generalized impairment of function which results in the loss of adaptive response to stress and in increasing the risk of age-related disease. As we grow old, yes, our fighting capacity comes down, including not only the disease but even also with the spouse. We all know this sentence was not to please my wife who is in the audience, but I think it's a general thing. As we know that with the age, the every organ's capacity comes down, the physiological functioning comes down, whether it is kidney, ureters, bladder, lungs, bronchi, pharynx, GI tract, or skin. We all know this horrifying data that 153 million senior citizens are there. Actually, we are still confused. For income tax purposes, age is different. For railway concessions, it was different. For ration making, it was different. I mean, somebody talks 60, somebody talks 65. Well, the Westerners are clear that they talk 65, but sometimes we say 60, sometimes we say 65. But it is not a uniform thing. For example, I'll feel bad if somebody calls me old, particularly if a young girl calls me old, I'll feel bad because I'm not old, I'm only 78. So if you say cut off line 68, I mean, why you go by the calendar year? Think of the working capacity, and persons like Professor Alka and Dr. Pereira, they will talk of activities of daily living. If you are able to perform your activities of daily living, you are fit and fine. Go ahead. Well, the elderly people, you can divide them into three segments: the young people, the middle elderly, and the elderly who require support. And hats off to IMA Kerala branch. This is the first IMA building which I am visiting, which has a provision for an elderly also to come to the dais in the form of a lift. I have never seen alone. Give a big hand to them. Now, the problems, even the medical problems, social problems, financial problems, all the three groups is going to be different. There are challenges, yes. There are challenges because of the disproportionate number in rise of the elderly. In last couple of decades, we have seen the elderly people going up very fast. Earlier, geriatrics was not recognized also. I remember till late 90s, when I used to request somebody, you become the member of Geriatric Society of India, person will laugh at me, yeah, OP, I'm not yet that old. Then I kept on listening it for a couple of years. Then my patience level got fed up. So then if somebody will tell me something like this, then I'll say, yes, you are right. Last night I spent 1 hour on the internet and I could not find a single pediatrician below the age of 12. So if you don't have to be a child to learn pediatrics, why do you have to be old to learn geriatrics? The health has always been a subject, it is state subject, and there has been always a conflict between state and the great administrator, the vice chancellor, Professor Yolekar is shaking his head. Even the implementation of health facilities have been different in different states. There are multiple systems. I know my father used to practice homeopathy, and in my house, my wife doesn't like allopathy. She would like more of the naturopathy. So we have different systems. In Ayush covers practically all of them, whether it is Ayurveda, Unani, homeopathy, Siddha, medicine, etc. There is a lack of knowledge about the medical services. I did a thesis in which Professor V.K. Arora sir was the guide and I was the co-guide of one of the students from Santosh University about the knowledge of availability of the medical facilities among elderly. And we found people suffering from extreme tuberculosis, they didn't know that the treatment is available free. Same way about the medical facilities, many of the elderlies don't even know. As the age rises, the number of comorbidities increase. Diabetes, hypertension, depression, dyspepsia, etc., everything rises. The prevalence of comorbidity and the aging, they jointly create more troubles. Swami Chinmayanand says that the basis of everything is finances, and that is true. So finances always come in the way of taking the treatment. The insurance companies also do not cover elderly. I tried my best to increase my insurance cover. They said no. Up to the age of 60, whatever the cover was there will remain the same. Only thing increase will be your premium. At IMA, we have been fighting. I have been from IMA headquarters for 3 years. I was the general secretary of IMA Academy of Medical Specialties. And first time I visited Kerala was when IMA did the conference at Kollam. The modern system of medicine is, however, not very friendly. First, you get the card made, you go meet the doctor, then he prescribes the test, then you go to the laboratory, then you come and collect the reports, and then you come again, and then you get the medication for which again you stand in the line. So it's quite a complicated one. And the political will has been always lacking, and the budget allocation was always very meager as far as health was concerned. Well, when we talk of different three segments of elderly, between say up to the age of 70, people require care not like as an elderly but like a young man. Because earlier, this Jawan used to retire at the age of 35. Then they kept on increasing the age, and the highest age was 65 when Supreme Court judges used to retire, and of course, the politicians never. But after the age of 70 and between 80, people more require, along with medical care, some kind of little assistance. But in elderly people, you require more of the medical care and hospice and home care, etc., etc. But friends, the attitude is changing. There was a time when my registrar used to tell, when I was a house surgeon in Safdarjung, my registrar used to say, "Oh, बुढ़ा हो गया, अब कुछ नहीं हो सकता, तुम्हारा कुछ नहीं हो सकता." But now that is not there. The attitude is changing thanks to the knowledge, thanks to the availability of various media by which the knowledge is getting spread. The print media, electronic media. And thanks to the medical facilities extension, I am glad the um Joint Commissioner of ESI is here among us. The public sectors, they extended medical and health support for their parents also. In the armed forces also, they started covering the elderly. So the coverage for elderly increased. That also was a good sign. The insurance companies have also now started covering the insurance up to all age groups, of course, with the higher premium. But de novo, they have started giving the new policies. The teaching institutions which are imparting MD degree are also increasing in the country year by year. And also certain various other courses. You heard Professor P.S. Shankar. He gave the idea during the COVID period that OP, you are sitting idle at home because of the COVID and eating food only, doing nothing. I said, sir, what do you want me to do? He said, let us do an online course. So he approached Khwaja Bandar Nawaz University, which agreed to certify it. And we had a 3 months online course in which twice a week we used to have two lectures on each day. And at the end of 3 months, there used to be an online examination followed by a certificate which we used to give to them. Many such courses have started. The government is now getting geared up. The political wage is changing. They are increasing the political budget. And lately, the Niti Aayog has brought out a wonderful document which I am going to show you. It's not that everything was there in the West only, whether it is for the USA or UK. Yes, there have been people like V.S. Natarajan and Nathan who started the first clinic in geriatrics way back in 1988 in Singapore. So we are not lagging behind. But the main gearing up came up after the year 1999 when there was lot of budget allocation and the budget was given to various medical colleges to develop geriatric facilities. At this juncture, in Geriatric Society of India, we all assembled and decided that we are following the Western book, J.C. Brocklehurst, which is not relevant for us. We are following the British books, which may not be relevant to us. Today morning, that there was a young lady who was talking about suicide. Well, actually, their situations here are quite different. The weather there, the social conditions, everything is different. So I said even the medical conditions are different. My society entrusted upon me the responsibility of bringing out the first textbook, and I brought out the first textbook in the year 1999. Followed by 2008, when we brought out the first Indian guidelines for vaccination in older people. We came first, then came API, followed by IMA guidelines. We revised the guidelines in 2012, 15, and then we brought out a concise book in the form of Vaccines at a Glance. Then the 1999 book we revised in the year 2004, then 2008, then 2015. And now we have revised it as GSI, our textbook, Principles and Practice of Geriatric Medicine 2015, which will be released during the inaugural function, and we'll be felicitating some of our speakers. We brought out a handbook. Then one of the visionaries in GSI, Dr. Kaushik, he came out with the idea, sir, we are talking about doctors and doctors only. What about the caregivers? I said, what do you mean by this? He said, there should be a course for caregivers. And he brought out this book which GSI supported, that non-clinical frontiers in geriatric care. And this was purely meant for training. And I'm glad that for last 4 years, Kaushik is doing a course on the training of caregivers for elderly patients. This book with 126 chapters have practically everything that the question may be asked or any information may be needed about elderly. Well, the government of India is not silent now. Government of India is making provisions. There are provisions in the constitutions. There are provisions in the law. They are creating geriatric centers in the hospitals, in the regional areas. There are regional geriatric centers also. The Ministry of Rural Development is also doing something. And Niti Aayog has taken a lead and brought out a position paper on the same thing. This is the man concerned who managed the COVID. Professor Vinod K. Paul. I met him and he said that, yes, we will listen to your ideas. What are your ideas? Please let us know. He showed me the senior care reforms in India, a beautiful document, a comprehensive document with all the information about elderly and what are the government schemes he has brought out. So, friends, question is, what are our suggestions? We know the number of MD seats are very limited and the number of elderly is huge. So, the geriatricians are not the answer for geriatric medicine, at least in this country at the moment. At the moment, what is there? To take care of elderly, we have to take the help of family physicians. Because all said and done, the elderly patient or anybody goes to the family physician first. And it is the family physician in whom the elderly confides everything. अपनी इनकम भी बता देता है, बीबी ने कल रात को खाने में नमक तेज डाल दिया, ये भी बता देता है, पड़ोसी की भी शिकायत कर देता है, पैसे की भी शिकायत कर देता है, एवरीथिंग. That means the older person needs advice about everything. So instead of geriatricians, we require family physicians, and there is no dearth of family physicians. We have more than 2 lakh family physicians who are registered with IMA during the length and breadth of the country. If they are involved in geriatric care, we can deliver the goods. We can have a geriatric care newsletter which can go to them. Nowadays, everybody has got an internet connection and a phone by which they can be trained. So the question is that how to take care of geriatric care? Let's split it into 2 parts. The present elderly, the present number of elderly people who are there, they are to be taken care, and the people who are becoming elderly every year, they are to be taken care. So the doctors who are coming up now every year, year by year from the medical college, how they are to be trained. So these 2 last slides of mine are most important, and that is what is my suggestion. We have a telemedicine teaching center, and this idea I took from All India Institute of Medical Sciences, Department of Pharmacology. Pharmacology department in All India Institute has started a 24-hour helpline about poisoning. You see a case of poisoning, you can give them a ring, you can ask them about the antidote, the availability of the antidote, the side effects, etc., everything. So I said, if we also have a telemedicine teaching center across the country, east, west, north, south, and center, we can deliver the goods. We can update our geriatric caregivers or family physicians by the same 5 centers. We can have the family physicians who may be updated about the social schemes, financial scheme, constitution, and legal provisions. I'm sure at least 10% of the people in this crowd do not know the law for senior citizens and parents care to 2017, which was brought out and which was a boon but is not being implemented much. The family physicians can be updated about the preventive aspects also, that is the vaccination. The vaccination came in this country by WHO and UNICEF. It was given free, and the caretakers were Department of Preventive and Social Medicine, who is to get a van also, who is to visit the rural areas, etc., etc. But in 60s, the moment the pediatrics came, they snatched away the vaccination from them, and vaccination became their bread and butter. But now, the vaccines which can work in children, why can't they work in adults? Why can't they work in older people? And for that, we made the guidelines, and updation of these guidelines to the family physicians can be done by these telemedicine centers. Now, the doctors who are joining the boys and girls who are joining the medical college now and will become doctor, they can be sensitized about geriatrics from the very beginning, because in anatomy and physiology we teach them the aging changes. So other portions like geriatric science, clinical presentation, different things, etc., can be put part by part in the curriculum, and in 5 years they can be exposed to geriatrics also. We have currently 783 medical colleges, and roughly about 80,000 doctors come every year. If these 80,000 doctors are also exposed to geriatrics, fine, you won't need much MD geriatrics. MD Geriatrics, if they are there, it's good. We have a super specialist and the facilities for researches. But day-to-day care, these people can do the job. Friends, my suggestion is not the geriatricians, but the family physicians can take up the challenge and do it. On behalf of Geriatric Society of India, I would like to convey Government of India that we are ready to undertake any proposal for the elderly care. Thank you so much. Mike.
Hello. Thank you very much, Dr. Sharma, for your visionary oration. I know you have been so much attached and rather one of the founder members of Geriatrics then, now, present. And what is the future? Very nicely presented, though I would call this just a bird's eye view, but it's enough material for every one of us to think. Yes, you very rightly said that it's the family physicians who have to take the initiative, and our MD Geriatrics will be their guides, their mentors. Thank you very much for giving this opportunity to everybody and listen to you.
Thank you. Thank you, madam.
Please be on the podium.
Thank you, Dr. Sharma ji again. That God bless us for materializing all your vision. Thank you.
Thank you.